Hi everyone, continuing on the risk assessment for assessing risk of anybody for heart disease in future. So these are risk calculators which are covered in my part 1. But what are these calculators? These are scientific, well-proven, evidence-based calculators that give you an idea how much is your risk for heart disease in future. Normally it is done for the next 10 years or lifelong risk. What these calculators include is the value of the risk factors. 7 risk factors carry value towards your risk for future heart disease. Diabetes, within cholesterol, the level of LDL, which is bad cholesterol, level of good cholesterol, blood pressure, obesity, that is measured by BMI, physical activity, your kidney condition, smoking. So these are the 7 risk factors most of these calculators use when you input the value, will spit out. Once you input the value and the value they spit out, it gives you different categories. Any risk less than 10% is considered as low risk. For any population, for anyone using these calculators, and as I said, they are available freely on Google. If you do, for example, Prevent is a calculator. You put these values, it will spit the value. If your risk is less than 10%, you come in the mild category. If your risk is from 10 to 30%, you come into moderate risk, and more than 30%, it comes into higher risk. There are tests that needs to be done within these 3 categories that will assess your heart condition. For example, anyone with a risk of 10% or less, we do a heart scan. Anyone with more than that, then there are stress tests. At this point, when you do the risk assessment, it is very important that you must see your family medicine person or your cardiologist. If you like my sessions, please like, subscribe, and share. Stay well and stay healthy. Bye-bye.